Hello, everyone, and welcome to the Healthcare Industry Podcast by Camomile Healthcare. Hi, everyone. Welcome to the Healthcare Leadership Podcast. I'm Raghav, the CEO of Camomile Healthcare, and today we have Karthik Rajagopal with us to talk to us about what the healthcare industry landscape is going to look like in India and abroad.
The knowledge, or at least fairly in-depth knowledge of the product or the service was not available. So that is something that we spend a lot of time on in terms of educating people on, what are they actually going ahead and, selling, because it becomes very, very important that an informed sales executive is a more productive sales executive, because they're able to finish the sales pitch quicker and then come back. They're able to go ahead and look at promoting their products and services much quicker. So that is one large piece. Corporate stroke insurance is another piece that is very, very critical, because these are all large funnels and large segments for a hospital. So that is something that's actually over there. The neighborhood has become a very, very potent segment for most healthcare institutions. Then is the digital piece, which then becomes a fairly large context right now. There is somebody who's a social media specialist. There is somebody who's actually going in and looking at only videos. There is somebody who's actually going in and developing content. Some of it is outsourced, some of it is in-source. So the traditional channels of managing physicians, smaller hospitals, to corporates, to insurance, to the digital functions. This is how the whole piece will go. And overlaying all this, obviously, is the public relations team, which again has started to go. Earlier on, we did have news coming out in a manner that was not very process driven, etc. Today, there is a PR strategy for a brand. We know what is it that we need to actually go out, to the media with, because perceptions are being formed when people read these releases in the media. So it's very important that PR forms a very, very critical piece in this whole area. Then what some brands have actually gone ahead and also experimented with is having product specialists, like they have in FMCGs, etc. So they would be a cardiac specialist, they would be a neuro specialist, they would be an orthopedic specialist, etc., just to go ahead and get the depth of the specialty also right. So this is also some things that people have gone ahead and experimented with. And as you actually start to go ahead and see how marketing evolves,
So the product specialists, are they pure marketing teams, or are they also operational teams? Like there's something that we see as service line manager. Are we talking about that, Karthik?
Yeah, see, in the sense that at the sales level, we are actually going to go ahead and identify smaller hospitals or physicians who may have a large practice in a particular specialty and could funnel that to a super specialty hospital at the right time. So they would be a sales product specialist, they could be a marketing product specialist, and internally, that probably would be your international marketing, which is again something that has gained a lot of prominence. Obviously, large groups offer a certain number of hospitals for international patients. They may not probably offer everything.
So, as the COO or the operations head of one of the largest hospital group and other positions that you held, how do you get this right? See, finally, I think it's also, if the doctor doesn't perform, the whole hospital suffers, or if the medical equipment malfunctions, I think your reputation is at risk. What kind of a systems do you put in place? How do you make sure that all the levers are running well?
Raghu, I think there is a saying that great leaders and teams are masters of the basics. And I think hospital operations is complex if you want to imagine that way. But if you were to actually go ahead and get all the basics right, with the right measurement metrics and the key performance indicators, I think this is something that you can actually go ahead and run it really, really well. It's when we take the eye off the basics, because sometimes what happens is, when we do have chats with patients on feedback, etc., the feedback is so basic that such misses should never have happened in the first place. So therefore, I think if you really look at the key to hospital operations and management is one, we need to actually go ahead and take care of our employees and people very, very well. Sometimes what happens is structurally the top half of the hierarchy gets a lot of attention, when the bottom half, which is actually engaging with the patients, probably go through a very, very monotonous day in and day out job. So handling the frontline well will ensure that whatever you want to go ahead and communicate through your brand language is getting communicated and rendition well to the patients. So taking care of them, taking care of the lower part of the hierarchy in a hospital becomes very important. Then obviously is clinician management. Sometimes we believe that management and medicine will need to go ahead and have an aisle between them. That is something that needs to actually start getting a lot more fused, because if we do have exceptional clinician management and engagement, I think they will also come back to go ahead and look at running the brand the way we want the management wants to run the brand. Obviously, next is service excellence.
Wonderful. I think that's very heartening to actually listen to. Even I felt hospital operations are very complex, but good to see your perspective and hear your perspective that it's not complex if you actually organize things well and delegate and have a proper structure in place. So have a risk management mechanism, I think, is going to be important. I think is the message that I'm taking away from you. Thank you, Karthik. Moving on, I think one burning topic that we have today is healthcare costs. As you had seen, cost of care has drastically increased, by multifold in the last 15 years. I think it's increased by at least 8 to 10 times, if I'm not wrong. What are the factors that are driving this cost? And if you were to look at a typical P&L of a multi-specialty hospital, what take a revenue of 100, and an EBITDA margin of between 20 and 25%. So where is the balance 75%? What is the balance 75% made up of?
As a percentage of overall healthcare payment is very high compared to out of pocket. So in India, when it's actually going ahead and being looked at as out of pocket, it just seems that the costs are very high. But if you do have a proper health insurance plan, if you do have a very, very healthy lifestyle, and if you're able to go ahead and take care of because if somebody's healthcare regimen is not very, very right, they will naturally blame it to healthcare inflation when they actually come and get themselves admitted in the hospital, which is why I think health insurance becomes a very, very important piece. And if you can get somebody to at least partially underwrite your healthcare expenditure, you don't really find the pain that much.
So there's a lot of interest in healthcare management. A lot of students are moving into MBA healthcare management and public health and other faculties. And hospital industry also is embracing a lot of talent. So how do you see them moving ahead, and what skill sets should they really develop?
See, I think Raghu, as you start to go ahead and move up the healthcare hierarchy, I do believe that the missing points are obviously, they're very, very operations and inward focused rather than having a very outside in perspective. So a strategic mindset is something that is very, very important to understand. And, the way they actually go ahead and use the intellect and how they're actually going to go ahead and push boundaries needs to be one. The never stop learning philosophy is very, very, important as far as budding healthcare managers are concerned. Now, the missing points, in people who've actually started from different departments, I felt are marketing strategy and finance. These two, they do have, either they fear numbers, they actually go ahead and don't have a very strategic mindset. So I think the fear of numbers should go. They need to start looking at data very, very clearly. They need to do a lot of, number crunching, and they need to be comfortable in the world of numbers, which again is very, very important. The service mindset, and I think that's very, very important, that whilst they actually move up the hierarchy, the closeness to the patient base will be something that is very, very important, because people often say in the services industry, the higher that you go in the hierarchy, the further away you move from your core, consumer base. That should not be the case, and they should be as close, because listening to patients and their experiences actually can make life very, very differently. Because unfortunately, I'll tell you, and I give this as an example to the entire team. If you were selling a telephone, if you were selling a car, you could drive a competition car, you could drive your own car to go ahead and find out what the faults were. But if you were to go ahead and find out, the experience of a cardiac a surgery patient, you can't undergo a cardiac surgery yourself to go ahead and find out what the patient went through. So therefore, listening to patients becomes a very, very critical component of success. And therefore, it's very important that they spend, time over there. And their ability to actually go ahead and, have a seamless relationship with the clinicians also becomes, very, very important. And the last thing that I would actually go ahead and look at, while you can, get into a digital mindset, you can do everything that is possible, is that big capital letter H, which stands for humility. Sometimes what happens, Raghu, in a hospital context, it's a very hierarchy driven, industry, and people at the rising to the top at a hospital director level or a facility head level can actually, feel that they become larger than life, with everybody actually, falling all over to go ahead and please them, etc. So I've seen some people, as they actually start to move upward, move away and distinctly away from humility. I think that is something that they would need to actually go ahead and, maintain. They need to have their feet and the rest of the system absolutely on the ground if they have to go ahead and start to become successful when they, become seniors. Because somewhere down the line, I did feel that, the power hungriness got into, people, and that prevented them from actually starting to see rationality in what they did. Egos, etc., started to actually go ahead and come in. So I would still think humility would be a very, very, very big, asset as people start to go ahead and look at, moving up the ladder. I'm not saying humility means being a pushover or being somebody who can actually be manipulated with. It's somebody who actually does not go ahead and, look at hurting pride of people, the respect for individuals, etc. That needs to actually go ahead and, come very, very quickly. And for people who spent, as I told you, a number of years in operations, their perspective of an outside-in system starts to actually minimize over a period of time, and they start to go ahead and put their problems ahead of the consumer problems. So if the patient says that, look, this is something that I would like, the immediate retort is, no, this is not the way we do it. So this is the way we do it. Needs to change it to, this is the way the patient, wants us to actually go ahead. So that shift should also be there, and consciously they need to start preparing for these higher roles as they start to enter the industry itself, by observing leaders, by actually taking, learning a lot, and starting to go ahead and imbibe a lot of things before they actually start to go ahead and move on the hierarchy. So this probably would be what I would actually say, tell the youngsters.
That's a great piece of advice for all those budding hospital managers. Thank you, Karthik. I think in a nutshell, I think you captured what it really takes to move up the value chain and move up the ladder. I think we just have one more point we want to discuss with you before we wind up this episode. What does your typical day as a COO of one of the largest hospital group look like?
See, Raghu, you really, can't, plan your day, in the sense that obviously the firefighting bit in hospitals, something is it probably going to go ahead and stay for a while, because you don't know when there is an, emergency. But we try, I try and look at it from the piece that, look, what is going to be significant. I spend a lot of time on looking at evolving our digital strategy, because that's the next big thing. We spend a lot of time on how is the industry going to look in the future. So, that's digital health, the new changes in, telehealth, etc. Spend a lot of time with clinicians, spend a lot of time, and we do have, direct interaction with patients, where patients come and give their feedback. So I do try and listen to that to a very, very large extent. But overall, I think the most important things would be the digital roadmap for the company over the next couple of years. Our key engagement with clinicians, are listening to consumers, what's actually data throwing to us in terms of challenge. We are also, attrition in this industry is high. So we do spend a lot of time talking to, high potential people who want to actually go ahead and look at moving on to see if they can actually get, a better structure within. We tend to spend a lot of time on trying to evaluate, saying that where can we fit people in different roles so that monotony doesn't set in. So these are all things that, actually take the day.
Amazing.